Hi, I'm Dr. Roth. Today we're going to talk about spinal stenosis and its implications with certain symptoms that patients have. Spinal stenosis is a problem that about 50% of Americans will have by the time they hit the age of 70. So common symptoms that patients will often feel are pain, numbness, tingling, burning, and or weakness in the legs. They'll often feel pain in the back, but sometimes they won't feel pain at all. So I'm going to demonstrate what causes spinal stenosis. First of all, we have a normal model here. This is a three-dimensional model that shows what the lowest two vertebrae in the back look like. The two vertebrae show a normal disc. We have two discs here that are normal height, normal thickness. There's no thinning of it. We don't see any bone spurring here. We see the nerves that come out that are connected to the spinal cord, and those nerves affect the feeling and the function in the legs. As we start to have the effects of aging and wear and tear on the spine, we'll start to see some disc thinning. We'll see that the disc dry out, and I often describe this as a disc like this that's degenerated is much like a piece of beef jerky that is dried out and is very brittle and it doesn't move very well or bend very well. A healthy disc is much different. It's well hydrated, it's thick, it's got a healthy springiness to it. It functions more as a shock absorber between the vertebrae. So when we look at a degenerated spine versus a healthy one, we'll often see that the disc is thinned down. We'll see that the opening where the nerve comes out has thinned down. So this can cause nerve impingement here. But even more importantly, if the disc thins down and it starts bulging towards the back of the canal here, that causes a closing down on the canal. It narrows the opening, so now we have what's called spinal stenosis. So ordinarily when patients develop this, one of the common treatments or the conventional approach to this is to do a back surgery called a laminectomy. In a laminectomy, they actually take the back part of the vertebra and they remove it, and it does decompress the spine, but it causes a lot of stability issues, and many times these surgeries fail because the back loses stability the more bone and tissue they remove. So here we can see what a laminectomy would look like with the back part of the vertebra gone. Now, in many cases with somebody with spinal stenosis, once the back part of the vertebra is gone, we'll often see later on that the vertebra starts to migrate like this. It will start migrating forward. And when that happens, the patient starts actually having symptoms again like pain, numbness, tingling, burning, and weakness down the spine. So the surgery can actually lead to further problems in the future. Now, if we take a look at a graphic display of this is kind of a cartoonish graphic, but this shows, let's just take the model and compare it to this. This shows a normal looking spine on end. So we're looking at it from a top-down view. We can see the spinal cord here, the nerves that come off the spine. Those nerves actually go out and form the sciatic nerve and the plexus of nerves that goes down the legs. And again, their two functions are for sensation and for motor activity. So if these nerves get pinched, they can affect the muscles and they can affect the feeling in the skin. Now if we take this one and we turn it this way, we're seeing the same thing from the side. So we're going to simulate what spinal stenosis looks like. So again, we're looking at it from this angle and we're looking at it from this angle. So let's draw an arrow on here. So I'm going to have you keep an eye on what's going on the screen, and I'm going to narrate this as we go here. So let's draw a couple of arrows here where we're going to demonstrate where spinal stenosis is going to take place. Okay, so there's one point there, and there's one point there. Okay, so as we move the slider bar, watch those locations and what happens to the spine from age, wear and tear, and a closing down of the spinal canal. So now we have a bottleneck in the opening. So here we have the disc compressing back towards the cord. We have this ligament, this is called the ligamentum flavum. It has enlarged because of the instability here, and now it's starting to bottleneck right here. So that's stenosis. And if we look here, we can see the same thing happening from a different angle. Now we see the ligamentum flavum compressing here, and we see that the disc is actually compressing backwards towards the cord. Now I'm going to reverse this, and we're going to show how spinal decompression therapy, the treatment that we do here, will non-surgically treat this and it won't jeopardize the stability of the spine. So let's reverse it again and watch what happens to the canal. Okay, so here we go. We're going to open it up. And that's how spinal decompression reduces the pressure on the spinal cord. Now, if a patient doesn't have permanent nerve damage, they're going to actually experience potential increase in strength in their legs. Then they have pain, numbness, tingling, or burning going down their legs. It's going to usually go away. But let's also take one step further, and we're going to look at the, let's just erase this here, and we're going to go to symptoms. Now, if we look at this, we can actually see where these nerves travel down the legs from the low back. So if the cord gets pinched, it's going to affect these nerves. Now, if we go up here to what we call dermatomes, dermatomes are patches of skin where these nerves travel. So if you pinch the respective nerve, it could potentially affect the feeling that the skin has over that surface area there. So like, for instance, the fourth lumbar nerve root affects this yellow patch of skin here. The fifth lumbar affects this one. The first sacral nerve root affects this one. Every nerve that comes off the spinal column, and there are 31 pairs of them, every one of them has a patch of skin that it goes to that it affects. So if the nerve is working properly, a patient will feel normal sensation. They'll be able to detect the sense of touch and other common sensations that we feel when something touches our skin. Now, if the nerve gets compressed, it's going to cause pain, numbness, tingling, or burning to travel to those specific dermatomes. So basically, again, spinal stenosis is the narrowing down of the opening where the spinal cord travels, and we're going to look at it one last time. And when it compresses, it looks like this, where the cursor is here, and it looks like there, this part where we see a bottleneck of the opening. This is what spinal decompression therapy does. And so we can actually do this in a very non-invasive way and get the patient's normal functions to return without having to do any kind of surgical procedure or risk any complications that might occur in surgery. So there we have it. That's spinal stenosis.